Today we're going to talk about your pelvic floor and how on earth you relax it. Stay tuned. Today we're talking about your pelvic floor. So for those of you who don't know, your pelvic floor are essentially the muscles that sit in the bottom part of your pelvis. So if here is your pelvis, you've got these two bony parts right here. And then you have basically down here where your sexual organs and reproductive organs live and your digestive organs. You have a sling of muscles essentially that sits at the bottom of the bowl that activates all those sphincters. So there are 3 layers of those muscles, and essentially they work together, slide across of each other, contract and relax, and they also work with your diaphragm, which we've talked a lot about this year, in raising and lowering to basically work as a piston to engage your core and also force air up and through and out of your body. For me personally, if you guys have been reading my blog or my website, you know that I've personally struggled with a lot of pelvic floor tightness. I don't have kiddos, but I do have a high stress job and am more of a type A go, go, go person. I have trouble relaxing. Just in general, my muscles tend to be on the tighter side. There is a spectrum or a scale, and those who are typically more flexible tend to have a harder time building muscle mass and typically struggle more with muscle weakness, where other folks, like if you're me on the other side of the scale, have an easier time building muscle, being really strong, but flexibility is something that we have to work on and be really intentional with. What I figured out was that I had pelvic floor tightness, and the way it was manifesting for me was that I was having urinary urgency issues. I was having a hard time allowing my bladder to fill. I felt like I had to go to the bathroom all this time, and I would often not make it in time. So I had that urinary urgency component, and then I also had that incontinence component. Urinary incontinence is basically not being able to hold the sphincter closed and basically peeing your pants or having leakage. And the urinary urgency was like, okay, I go from not having to go to the bathroom at all to like, I have to go right this second, otherwise I'm literally, my bladder is just gonna like explode out of my body. And so there are different types and different reasons why those symptoms can manifest. So it could be because of muscle weakness, and it could be because of muscle tightness. In my case, it was because of muscle tightness, and I think a lot of women really have a lot of pelvic floor tightness, but they're just not aware that this is a thing that could be causing other issues, and so they don't really even know to have it checked out. So what I realized once I went through pelvic floor physical therapy was like, holy cow, this changed the game. Like, my core is able to activate better, I'm able to belly breathe better, I have less anxiety and less stressed because my body is actually functioning the way that it was meant to function all along. I just didn't know that this was tighter because it just didn't occur to me until I had other physical therapist friends then being like, hey girl, like I know we've like talked about some of this stuff that you're dealing with, I definitely think you should go. And I took them up on it. And it was the scariest thing I've ever done, but it's also the most empowering thing I've ever done, which is why I'm such a huge advocate for pelvic floor physical therapy. Your pelvic floor and your diaphragm are kind of like right here, right? So your diaphragm sits, it's more of like a upside down U shape, and then your pelvic floor is more of like a regular U shape. And so when your diaphragm drops, your pelvic floor drops, and when your diaphragm comes back up, they go back together. So if you breathe in, your belly extends, your diaphragm drops, your pelvic floor drops, and then your belly relaxes, you breathe out, and they kind of return to normal. If your pelvic floor was like mine, clenched in a fist 100% of the time, it can actually raise up. So not only is it not in its appropriate resting position, it's actually like 3 elevator floor is higher. So when your diaphragm drops, it shortens this area in between. And so there's not as much room for your body to work. It's just shortening the system. It's making it more of a struggle for you to do simple activities like just breathe. If your pelvic floor too is raised up, that leaves less room for your bladder, less room for your sexual organs, less room for pretty much everything. Learning how to kind of tune into your pelvic floor just in general, like step one is like, I mean, where is it? And how do I like connect my mind with that muscle? Step two is learning, like, as I breathe in, feeling and being able to let that pelvic floor go, let it relax so it's not on 24/7. And then as you breathe out, like feeling it go back together. So the easiest way to do that is by lying down, which I'm going to show you guys in a minute. But I want to give a disclaimer because a lot of times we have such a disconnection, especially as women, from our pelvic floor and our brain, that it may not be a bad idea for you guys, whether you're having issues of like urinary incontinence, pain with sex, or anything like that. Like if you just feel like you're actually just totally normal, you're not having any issues at all, it may still be in your best interest to go to a pelvic floor therapist, do some internal work where they're able to feel those muscles contract and relax. They're able to cue you and tell you what you're doing, and so you know, like, it's so much easier to make that mind-body connection when you have the assistance of a medical professional. So I would 1000 bajillion% encourage you guys to do that, whether you're having a dysfunction or not, just to learn about how your body works and to feel empowered, like, I can control these muscles down there. That is huge, you guys. That's so huge. And honestly, too, something I don't talk about a ton, but I have a previous history of sexual assault, and so that emotional component also contributes to my muscles just locking down. There is a ton of research out there that shows that our muscles actually remember traumatic events and they contract to protect us. And so if I had an incident where I was sexually assaulted, my pelvic floor contracted and basically was like, I ain't letting go because I don't know if it's safe. For years, for like literally 15 years now, I'm finally able to be like, nope, it's okay. Like, that was obviously a traumatic event. I've done a lot of counseling, a lot of therapy, a lot of my own stuff to get through that. And I encourage anybody else who's had that experience, which for us women is like 75% of us, which is horrible, to seek out counseling, seek out therapy, talk to someone, talk to your even medical professional, anybody, to just start kind of knowing that that's not your fault and that there's other implications in how that shows up in your life. And so, gosh, it's still emotional. It still kind of gets me, right? And it always will, because it's part of my story, and it might be part of yours, or if it's not part of yours, it's probably part of a story of someone else that you know. So pelvic floor is a really sensitive topic because there's just a lot of emotion and just a lot of stuff that goes along with that. That being said, we really need to learn how to control our bodies and how to just like be gentle with our bodies and have that brain-body connection, mind-body connection. Let's teach you guys how to relax that pelvic floor. So the first thing you're gonna do is lay down on your back. You wanna focus on doing your belly breathing that we talked about in a different video. So if you have not watched that, go ahead and pause this video and click on the link below. But as you breathe in, I want you to kind of contract your pelvic floor, not like your whole glutes and your whole adductors, but just kind of where your vagina is, and just gently contract that muscle and then try to release it. So as you breathe in, feel it kind of drop, and then relax, breathe out, and then try to contract and relax. Sometimes as you're relaxing, if you're really struggling with relaxing, you can push your belly out too. It's a compensation mechanism, so you want to eventually be able to learn how to just relax your pelvic floor with the muscles themselves, but it is an okay starting point. So again, you're just going to contract your pelvic floor and then relax it, either by pushing your belly out or just trying to release release the muscles. It's such a tough, small spot for you guys, for anyone really, to learn that this is, again, why really, in order to really know if you're doing it right, you really need a second person, a pelvic floor physical therapist, which I'll link below in the descriptions, like find a pelvic health PT link for you guys, because it's just so hard to know if you're activating the right muscles. Again, there's 3 layers of those muscles, and might not be able to activate them properly if one of those layers of muscles has like a knot in it, or if you have gone through a birth and you had a traumatic, birth itself is a traumatic pelvic floor event, and so, you know, you may have had a episiotomy or had it sewn up a little bit. There might be scar tissue in that area. You might literally need a pelvic floor PT to go in there and release the muscle tightness, like the trigger points that are really actually throwing the whole system off. So if you can't relax your pelvic floor just by trying this exercise, I know I wouldn't have been able to, then I would just work on belly breathing and get yourself into a pelvic floor PT. Put it on your list. Be like, this is something that is important to me, and I am really willing to go out of my comfort zone. And let me tell you guys, a pelvic floor physical therapist is 1 million, literally 1,000,000% less awkward than going to the gyno. You know, when your gyno like comes in, they're like, stick your feet in the stirrups, like, and that's like my voiceover of like what it's like to be in a gyno, because, you know, they've got 7 minutes. The average doctor spends 7 to 10 minutes with their patient. With a pelvic floor physical therapist, it's gonna be gentle, it's gonna be slow, it's gonna be at your pace, and you're gonna have somebody in there for 30 to 45 to 60 minutes, depending on what clinic you go to and what their process is. And also sometimes they have different like pay scales if you go for 30 minutes versus 60 minutes. So for me personally, I went for 60 minutes for a couple months. I liked the 60-minute appointment, so I kind of kept that. I also had the option to go down to 30 minutes, but I chose the 60 minutes twice a month, and then we went down to once a month, and it was just at my pace, and I wanted to go really slow, so it ended up being like a 4 or 5 month process. And it's still a journey that I'm on, and it's still something that I work on, and I fall off the wagon, forget to do my exercises, and then I might realize like, oh my gosh, my pelvic floor is getting tighter again, because muscles do that, because I'm stressed, because got a lot going on. Hashtag military wife life, and hashtag student loans, and all the things, right? Working 40 hours, moving, all that stuff. Something that's gonna be a process for you guys, but again, if you really struggle even being able to like know if you're contracting the right muscles, 100%, get your behind to a pelvic floor physical therapist and let them work their magic on you. Your life literally could probably change in ways you can't even imagine. Less of a struggle, right? Like if your pelvic floor is happy, like trust me, girlfriend, you are gonna be much happier. So if you like this video, make sure you hit the like button, subscribe, share this video with a friend, and if you have any questions or topics you would like me to cover, make sure you drop those in the comments below. Bye guys.